CAP Tulsa began as a volunteer-run organization helping migrant farm workers who faced horrific working conditions. Over the decades, we've continued to help low-income people improve their economic circumstances. We've evolved our strategy so that we now prepare young children for school through high-quality early education and parent support services. Our approach is based on the idea that preparing poor children to be ready for kindergarten is the best path towards their future economic success and presents the greatest chance to break the cycle of poverty. While research has demonstrated that high-quality early childhood education can be successful in increasing disadvantaged children's developmental trajectories, few attempts have been made to produce similar results at scale. Our objective is to create a community-wide demonstration that improved outcomes for poor children can be achieved. We're committed to the pursuit of excellence through continuous process improvement. We consistently analyze data to build program offerings based on what the data says is and isn't working. Our focus remains on incorporating what we learn into our daily practice. We draw from the lessons of others in the field and operate in a manner which is designed to be transferable to other communities. Given this focus, the heart of our work is to attract high-quality staff and build a leadership system to manage a high-performing, results-driven organization. As an organization, we pay attention to the process of incorporating research results into daily practice by implementing programs with fidelity to models already proven to work effectively. We continually evaluate the results of our services and encourage program refinement as we proceed towards finding out what really works for children and families. The long-term success metric for our organization is clear. Our children who have received our high-quality early education and family support services moving into a higher socioeconomic class than the one they were born into. Along this path, the short-term success metrics are also clear and include the degree to which our children enter kindergarten ready to succeed, as measured across the developmental domains of physical health, social competence, emotional maturity, cognitive skills, and communication skills. We're developing a paradigm that doesn't yet exist in this country. Historically, the U.S. child care industry merely provided a place for children to be reasonably safe while their parents worked in low-wage jobs. There was no focus on preparing them for school success. Today, we're building a system outside of the common education system, but one that's still closely aligned so that the most at-risk children get what they need for an equal chance to succeed. In addition, we're building a system that operates at a community-wide level. Fundamental to this new paradigm is the necessity of a high level of parent engagement. The parents of at-risk children must be engaged as primary caretakers and financial supporters of their families. Our biggest accomplishment is the more than 8,300 children who have graduated from our early education programs before moving on to kindergarten. We know that each child who experiences high-quality early education is better prepared for success than children who don't have such opportunities. We're proud of the early education infrastructure we've built across our community, spanning multiple urban school districts. Of the 12,000 children who are under age 5 and live in poverty in Tulsa, our organization has the capacity to prepare nearly 20% of them for school entry. Furthermore, we've improved the outcome not only for the children whom we've served, but for their families as well. The combination of early education with services for parents places us at the forefront of some of the most promising, comprehensive anti-poverty approaches. In order to sustain and expand high-quality program options, public and private donors must invest heavily so that our services can meet demand. Without early interventions, many at-risk children will end up costing society a great deal because they're unequipped with the tools they need to succeed as productive citizens. Unfortunately, our current system seems more resigned to pay later through costly remediation when prevention and early intervention strategies have the best long-term return on investment. Despite our growth, we've yet to reach the critical mass necessary for widespread community change in regards to breaking the cycle of poverty. Additional resources are needed to continue testing, refining, and expanding what works to help prepare children for future success. We need resources to inform new practices and also to reach more children. Significant results can be achieved, not only locally, but also nationally, when we've served enough at-risk children with enough high-quality early education that their paths are changed. We struggle to create services that prove effective for a majority of the parents of children enrolled in our programs. These adults, whose behaviors are already established, have proven to be difficult to accommodate with programs to which they're receptive and that improve their circumstances. Efforts to improve outcomes for children are inseparably tied to the economic and physical health of their parents. Another challenge is providing an adequate dosage of high-quality education. While most children leave our program prepared to enter kindergarten, we serve many children that face extremely difficult circumstances. Given funding constraints, the majority of children don't enter our program until they're at least 3 years old. However, for many children, earlier interventions are needed. We're striving to serve more children under age 3 to foster the development of the most at-risk children.